The sound came first. One sharp chirp from the heart monitor, then a long, flat tone. On the screen, the green line went straight and stayed there. Hands paused over the body. For a moment, the whole room held its breath. Dr. Aaron Cole stood at the foot of the bed. The young resident doing compressions had sweat in his eyes and a tremor in his arms. His hands still pumped on the patient's chest as if they had not heard what the monitor was saying. "Time," Cole said. 17 minutes, a nurse answered. Cole glanced at the clock above the door, then at the screen. The tone filled the gap where heartbeats should have been. Time of death 21:07. The resident froze. For a heartbeat, he looked ready to argue, then his shoulders dropped. A gloved finger pressed the button. The tone cut off. The silence that followed lasted only long enough for someone to sigh. Outside Trauma Room 4, St. Augustine Medical Center sounded like it always did on a hot night in Phoenix. Phones rang, wheels rattled over old linoleum. A voice called for labs. Somewhere down the corridor, a child cried in short bursts. The desert heat pressed at the glass doors of the ambulance bay, while the air conditioning blew cold on damp skin. Cole stripped off his gloves and tossed them into the red bin. His white coat stayed clean. Across the corridor in Trauma 3, a woman in navy scrubs stood at a supply cart and tied her mask. He watched her for a moment. Her hair was pulled back tight, no loose strands at her face. Her hands moved in quick, economical lines as she checked the tray. Scalpel clamps, sutures, gauze. Her fingers brushed each item in the same order twice without looking down. Cole lowered his tablet. "You are the transfer," he said from the doorway. She did not start. She finished with the mask, then turned toward him. "Yes, sir. Riley Quinn, surgical resident year 2. I can read a badge, Dr. Quinn." He stepped into the bay. Up close, he could see the faint red line where scrub brush had met skin at her wrists. She had scrubbed in for something and never reached the table. 2 programs in 3 years, he said, tapping his tablet. Most people finish where they start unless something is off. "There was a mismatch," Riley said. "Portland was not a good fit." "For you?" Cole asked. "Or for them?" She let the question pass without an answer. As she reached for a pair of gloves, her sleeve slipped back. Ink curved over pale skin on the inside of her wrist, a staff wrapped in a ring of dots and dashes. Cole frowned. "What is that?" Riley paused, then slid the glove on. Latex snapped into place and hid the mark. "Something personal," she said. "We have a dress code here," Cole replied. "Tattoos stay covered." She met his eyes. Her gaze was cool and steady without the jitter he expected from a second-year resident. "It will stay covered," she said. They watched each other for a moment. Somewhere down the hall, a monitor beeped in a steady rhythm, ordinary and alive. "Fine," Cole said. "You are on appendectomies today. Dr. Singh will supervise. Pre-op in Bay 7. He tapped the tablet again. "Routine list. Think you can get through it without improvising?" "Yes, sir." "Good. I have read your file. Transfers gaps, a very brief stint at a clinic in New Mexico, then another move." His eyes narrowed a fraction. "That pattern usually means someone has trouble following protocol, or they think they are smarter than the people teaching them. Which one are you?" Riley kept her voice even. "I learn fast." "Learning is not the same as experience," Cole said. He turned. "And keep that tattoo under the sleeve, Dr. Quinn. This is a hospital. Try to look like you belong in one." He walked back into the corridor. Noise rolled into the bay again. Overhead, a voice called respiratory therapy to room 12. A supply cart squeaked past. Riley let out a slow breath. "Do not take it personal," a voice said near the medication cabinet. She turned. A nurse in dark wine-colored scrubs stood there sliding vials into a tray. His badge read, Jordan Reyes, RN. His hair was cropped close. His stance was balanced and loose, like he was ready to move before anyone told him to. "He is like that with everyone," Jordan said. "Cole." "I figured," Riley replied. Jordan looked her over, not lingering, just taking stock. His gaze paused at her sleeves, then at the orderly tray she had set up. "You prior service?" he asked. Riley's fingers stilled for half a second, then picked up a pack of gauze. "Why would you ask that?" Jordan shrugged. "You check your gear like you expect it to fail," he said. "Same order twice over, no wasted motion. Residents do not usually do that." "I have worked in a lot of places," Riley said. "Sure." He closed the tray and slid it into the cabinet. "If you need anything," Jordan added. "I'm usually in trauma 2 or 3. Riley nodded. "And for what it is worth," he said, "you handled him better than some attendings do." "Handled who?" "Cole." Riley almost smiled. "I have met worse." Jordan let out a quiet breath that might have been a laugh, then stepped into the hall. When he was gone, Riley looked once at the empty doorway, then at the sink along the wall. The metal basin gleamed under harsh light. Her wrists still felt faintly warm from the scrub water. She had spent 2 months at St. Augustine moving in straight lines, keeping her head down, doing what she was told and nothing more. Some habits faded in new places, others did not, no matter how far you went from the desert or how hot the water ran at the scrub sink. The page came while Riley was rechecking the tray. A quick buzz at her hip, then the clipped voice from the overhead speakers. Dr. Singh and Dr. Quinn to Operating Room 5. Repeat Singh and Quinn to OR 5. Riley pulled the message from her pager with a thumb. Bay 7 pre-op suspected appendicitis, young male, stable. She left Trauma 3 and stepped into the corridor. The air smelled of disinfectant and something fried from the cafeteria faint under the cold, recycled breeze. Fluorescent lights hummed overhead. A gurney rolled past wheels squeaking in a sticky rhythm. Bay 7 held a lanky college kid with freckles and an IV in his arm. He lay under a thin blanket, a hospital bracelet digging into his wrist. His cheeks were flushed, sweat darkened the hair near his temples. Pain at 10 out of 10, he said when she approached, but only when I breathe. Good thing you do not need to breathe much, Riley said. He let out a broken laugh that turned into a wince. Name? Tyler. All right, Tyler. I am Dr. Quinn. We are going to take your appendix out. After that, you will be fine. Might even get out of a few exams. Can you write me a note for that? We will see how generous Dr. Singh feels. His mother sat in a chair in the corner. Her hands were knit together so tightly the knuckles had gone white. She watched Riley as if she could see through the scrubs. Is it routine? The woman asked. Yes, Riley said. Very routine. The word tasted careful in her mouth. She checked Tyler's chart one more time, listened to his lungs pressed along his abdomen. He hissed when she reached the right lower side. Rebound tenderness. The numbers and signs lined up in a familiar pattern. Outside. 5. The scrub sink gleamed under bright light. Riley scrubbed again, hands moving in circles up to the elbows. The water came out almost too cold, numbing the skin, then turned warm. She watched the pink line of her wrists under the soap, the way the foam made the faint scars appear and vanish. The door swung open behind her. You the transfer? A voice asked. Riley glanced over. Dr. Maya Singh stood at the next sink hair under a cap printed with tiny blue flowers. Her eyes were sharp above her mask. Yes, Riley said. Riley Quinn. Maya, Singh said. You are with me on the appendectomy. Straightforward. He is young labs match. Imaging shows inflammation and no free air. Should be in and out. Riley rinsed her hands. The water beat against her skin, hot, now almost stinging. Understood, she said. OR 5 was small and bright. Tyler lay on the table, already under. The anesthesiologist murmured numbers to the nurse at his head. Monitors blinked in steady rhythms, soft beeps marking each breath and beat. Riley took her spot on the opposite side of the table from Singh. The scrub nurse, Patricia, placed instruments on the Mayo stand, each one landing with a tiny metallic click. Everyone ready? Singh asked. Anesthesiologist gave a thumbs up. Patricia nodded. Scalpel. The first cut was clean. Singh opened the skin, then the layers beneath exposing yellow fat and the glint of fascia. The smell was the usual mix of cautery and body heat. Routine. Riley watched hands calm mine already following the path to the appendix. She knew this anatomy the way some people knew city streets. When Singh reached the peritoneum and eased it open, a different smell slipped through. Not strong, not yet, but wrong. An edge of sour rot in the warm air. Riley's shoulders tightened. On the monitor, Tyler's heart rate stayed stable. The numbers did not care about scent. Singh parted the tissue. The appendix came into view, swollen, angry red. There it is, Singh said. Textbook. Riley looked past the appendix. The nearby bowel glistened under the light, but in patches it had lost its healthy pink. Here and there the surface clouded gray. A thin film of cloudy fluid sat in the recess near the cecum. Riley inhaled slowly. Dr. Singh, she said. Yes. The tissue is discolored, and there is exudate. I think the appendix perforated before he got here. Singh did not look up. The CT was clean, she said. No free air, no fluid collection. Perforation can be recent, Riley said. Fluid first, air later. Smell it. Singh paused. The cautery still smoked faintly. She leaned closer. Patricia glanced at Riley with a look that said she already knew what was coming. Singh straightened. Vitals are stable, she said. We take the appendix close, monitor him on the floor. If anything changes, we bring him back. If we close now, Riley said quietly, he will be back in 6 hours in septic shock, maybe sooner. The room did not move. Even the soft beeping seemed to space itself out. Are you questioning my plans? Singh asked. I am saying the cavity is contaminated, Riley replied. We need to irrigate and debride, not just take the appendix out. Patricia's eyes flicked between them. Singh's jaw tightened. You are year 2, she said. You have not seen the complications that come from going looking for problems you do not need to fix. Riley kept her gaze on the field. I have seen what happens when you pretend they are not there, she said. The words hung for a moment heavier than they should have been. Singh exhaled through her nose. Fine, she said. Suction, let us see. Patricia handed over the suction. Fluid slurped away from the corners of the cavity. Underneath the gray patches stood out clearer, streaked with thin threads of pus. Singh's expression flattened. All right, she said. You are right. We will irrigate. She glanced at Riley. You can take the lead on that, Singh said. I will watch. Yes, doctor. Riley's hands moved in close. She asked for a retractor with a small lift of her fingers. Patricia placed it without a word. The muscle memory between them made the exchange smooth. Riley worked through the cavity with careful speed. Irrigation syringe, more suction, small bites of gauze, catching stray pockets of fluid. Each movement was efficient, no flourishes, no wasted sweeps. She checked for additional perforations for any corner where infection could hide. Patricia watched her head tilted the way someone might watch a familiar song played by a new musician. Nice hands, honey, the nurse murmured under her breath. Too nice for year 2. Thank you, Riley said. It took less than 20 minutes to leave the bowel looking clean and pink under the lights. Fresh saline pooled clear at the bottom of the field. Singh examined the work, tracing the edges with her eyes. That was efficient, she said. Her tone was neutral, the words were not. Where did you train before Portland, Dr. Quinn? I did my rotations in Boston, Riley said. That is not what I meant. Riley did not answer. Her hand stayed steady as she closed the deeper layers, placing each stitch in a neat row. Singh noticed. Those are not the interrupted stitches they teach here, Singh said. Closer spacing, different tension. They hold better in contaminated fields, Riley said. Military style, Patricia added softly. The word brushed the edge of the air, then settled. When the last layer of skin lay together under a fine line of sutures, Tyler looked almost peaceful again. The only traces of the chaos inside him were marks in a chart and a thin red line on his abdomen. Riley stripped off her gloves and stepped away. The monitor at Tyler's head beeped on steady and uncaring. Outside the OR, in the narrow space by the lockers, Patricia caught up with her. I have been in this room 30 years, EMTs, the nurse said. I have seen city kids, farm kids, book smart, street smart. You are not the usual kind. I study, Riley said. Patricia tipped her head. I have seen study, she said. What you did in there was something else. You have seen bad bellies before, the kind you smell before you open them. Riley reached for her cap. I have worked in a lot of places, she said. Yeah, Patricia replied. I bet. By the time Riley changed and headed toward the resident lounge, the adrenaline had thinned, leaving a fine buzz under her skin. The lounge smelled like burnt coffee and microwave noodles. 2 residents argued over a game on a cracked screen. Another snored face down on the couch. At the round table near the window, Noah Blake sat, with his feet up, scrolling through his phone. Sophie from Nights leaned over his shoulder. There she is, Noah said when Riley walked in, the star of OR 5. Riley crossed to the ancient coffee machine. I did my job, she said. Sure, Noah replied. You also told Singh she missed a perforation. Sophie's eyes were bright. Patricia sent a picture to the group, she said, of your sutures. Noah turned the phone so Riley could see. The image showed a neat line of tiny stitches, evenly spaced edges perfectly approximated. That is not how they teach us on service, Noah said. Where did you learn that pattern? I practice, Riley said. Noah snorted. My cousin was a field medic, he said. He sent me photos once, combat closures. They looked a lot like that. The words landed between them. A quiet pause followed. The pager at Riley's hip buzzed again, sharp enough to cut the moment. She glanced down. Incoming multiple trauma. Construction site collapse on the west side. All available surgical staff to emergency. In the corner, the coffee machine gurgled. Brown liquid filled her cup, thin and bitter. She picked it up, took one sip and set it back down. By the time the sirens from the first ambulances reached the bay doors, the coffee had already gone cold. The sirens reached the emergency bay in waves. Out in the ambulance corridor, the night air felt heavier, full of exhaust and desert dust. Red and blue light bounced off the glass doors and painted the white walls in pulses. Riley stood near the nurse's station as the charge nurse, a compact woman named Carla, shouted assignments over the noise. 3 vehicles involved. Structural collapse at the site. We have at least 5 critical more on the way. Cole strode in from radiology, already tapping on his tablet. All right, he said. Trauma 1 and 2 for unstable thoracic. 3 for head and neck. 4 for crush injuries. If it is walking, it waits. If it is talking, it waits. He looked up, the eyes scanning faces. Singh with me in trauma 1, Lewis trauma 2, Quinn. His gaze landed on her. You get the leg. Compound fracture, possible internal injuries, but vitals are holding. Trauma 4. Riley nodded. Yes, sir. Jordan appeared at her elbow, already pulling on new gloves. That is Bay 4, he said. You get the fun room. "What is wrong with the fun room?" she asked. "Bad ventilation," he said, "and the light flickers when someone turns on the CT in the next hall." A gurney burst through the doors. The first patient rolled past, blood soaking his shirt on the right side, face, pale breath, ragged. Cole peeled off with Singh toward Trauma 1 without breaking stride. Another gurney followed. This one carried a man in his 40s, jeans dirty with concrete dust, a fluorescent safety vest streaked brown. His left leg bent at a wrong angle, the shin bone pushing against the tented skin, ready to break through. A cracked yellow hard hat dangled from the head of the bed by its chin strap. "Trauma 4, Shippe," the paramedic called. "We were told to bring him here." Riley moved with Jordan into the bay. The flicker in the ceiling light came every few seconds. It made shadows jump across the man's face. "Name?" Riley asked, reaching for the sides of the gurney. "Mike," he gasped. "Mike Thompson." His voice shook. Sweat beaded along his upper lip. His fingers dug into the rails. "All right, Mike," Riley said. "I am Dr. Quinn. We are going to take care of you." "Leg," he hissed. "Feels like it is on fire." "It looks upset," Jordan said. "We will give it something to calm down. Doc?" He glanced at Riley, seating the floor. Riley placed 2 fingers at Mike's neck. His pulse thudded fast but strong. She read the monitor the paramedics had hooked up. Blood pressure in the high 80s, heart rate over 130. "Mechanism?" she asked. "Scaffolding failed," the paramedic said. His badge read, Ortiz. He was on the 2nd level, took a hit from a falling beam, then dropped, landed on the leg. "Any loss of consciousness?" Riley asked. "No, complained of leg pain and some left side pain. He was alert on scene, BP was a little better. He has been trending down." Riley bent over the leg. The deformity was obvious, the skin stretched tight over the displaced bone. The foot was cool, but she felt a faint pulse at the ankle. "We need traction on that," Jordan said. "We will get there," Riley replied. She moved higher hands, pressing along Mike's ribs, then his abdomen. She watched his face with each touch. "Tell me if something hurts more than the rest." "Everything hurts," he said through his teeth. She reached his left lower abdomen and pressed gently. Her fingers met resistance that felt different from muscle. A firm swell under the surface with a sense of something pushing back. Mike sucked in a sharp breath. "Right there," he said. "Feels weird, like fullness." Riley pressed again, more carefully this time. The area felt tight. It did not move with his breathing the way it should. "Get the portable ultrasound," she said. Jordan raised an eyebrow but swept out without comment. Carla stuck her head through the curtain. "Quinn, remember, you stabilize and hold. Dr. Cole will sweep once he has cleared the critical thoracics." "Understood," Riley said. Her eyes stayed on Mike's abdomen. "You have kids, Shikipi?" Soaz asked. His eyes flicked up in surprise. "Yeah," he said. 2, boy and a girl. Why?" "Because you are going to stay very still for them," she said. "Can you do that?" He nodded, jaw clenched. Jordan returned with the ultrasound machine, pushing it with one hand, already squeezing gel onto the probe with the other. "Here," he said, placing it in Riley's palm. The gel felt cold and slippery on her fingers. She positioned the probe on Mike's right upper quadrant, eyes on the small screen. Gray shapes came into view, liver, kidney, the space between. The familiar dark of solid organ, the thin bright line of the capsule. And there a black pool where there should have been nothing. An anechoic pocket collecting in Morrison's pouch. "Free fluid," Riley said. She shifted to the left side, then the pelvis. More pockets of black blooming where there should only be gray. "How bad is that?" Mike asked, voice hoarse. "It means you are bleeding inside you," okay, she said. "We can fix it. We need to get you to the operating room." Jordan's hand tightened on the bed rail. "Quinn," he said quietly, "Cole told you to hold." "If we hold," Riley said, "we will be watching him die in real time." Carla came back just in time to hear that last part. "You are not clearing anyone for the OR without Cole," she said. "We have 3 with chest trauma and 1 with a crushed pelvis. The rooms are full." "We make space," Riley said. "He has an intra-abdominal bleed. His pressure is dropping. He has maybe an hour if we do nothing." Carla folded her arms. "And if the bleed slows on its own?" Riley moved the probe again, watching the black areas shift and deepen. "It is not slowing," she said. Mike swallowed. "I do not want to rush anybody," he said, trying to joke, his voice thin. "But if you all decide to save my life, I am on board." Jordan huffed out a breath. "Vitals?" Riley asked. He read them off. "BP 78/42, heart rate 145, saturation is holding, but he is working for it." Riley turned to Carla. "Page the OR," she said. "Tell them we need a room for emergent laparotomy. Type and cross 4 units. Call for Dr. Cole if you want, but I'm not waiting to start the process." Carla hesitated, caught between the protocol she was supposed to protect and the numbers glaring on the screen. Another siren wailed outside. Somewhere a monitor alarmed in another bay. Fine, she said. I will page. But you own this if Cole is not happy. I will stand in front of it, Riley said. Jordan was already hanging another bag of fluids, opening the line wide. You keep talking to me, Mike, he said. Tell me about the kids. How old? 6 and 9, Mike said. Ella and Ben. She wants a dog. I told her I would think about it. You still will, Jordan said. Right, Doc? If he stops talking, we worry, Riley said. As long as he's complaining, we are good. It took 5 minutes for Cole to appear. His coat flared slightly with his stride. His expression said he had not stopped moving since the first ambulance arrived. What is this about an emergent laparotomy from Bay 4? He asked without preamble. Riley turned the ultrasound monitor toward him. Blunt trauma to the abdomen falling debris, she said. Free fluid in multiple quadrants, dropping blood pressure, rising, heart rate, abdominal tenderness. Leg is bad, but not what is going to kill him. Cole stepped close to the screen. The black lake of fluid sat there, unmoved by argument. You are sure, he said. Yes, Riley said. Could it be old, he asked, from something else? He was working a construction shift, Riley said. No history of liver disease, no coagulopathy, no time for an old bleed to hide in there. Cole watched her instead of the screen now. Protocol. Carla started from the corner, says we stabilize and wait for imaging if the patient is not crashing. His pressure is in the 70s, Riley said. He is crashing. On the bed, Mike groaned. Not to interrupt, he said, but I'm starting to feel like I'm floating. That bad. That is the blood leaving your circulation, Riley said. We would like to keep some for you. She looked at Cole. He needs an oar, she said, now. The head of trauma weighed the monitor, the patient, the young doctor in front of him, who spoke like she had seen this pattern more times than her record suggested. Or 2, he said finally. Page anesthesia, we are going up. He met Riley's eyes. You are assisting, he said. You pushed for it. You see it through. Mike let out a breath that might have been relief. Thank you, he whispered. They moved fast. Jordan and the paramedics pushed the bed down the corridor. The fluorescent lights streaked overhead white bars, passing, then passing again. The elevator doors opened with a hollow chime and closed around them. In the lift, Riley watched the numbers tick upward. Mike's skin had gone a shade paler. His lips edged toward gray. Stay with us, she said. Trying, he replied. In OR2. Everything smelled colder. Anesthesia slid over Mike like a curtain. The monitors took over the rhythm of his body. Cole scrubbed at the sink. Riley stood beside him, hands under the hot water. How many abdominal bleeds have you seen? He asked, eyes on his own fingers. Enough, she said. Enough for what? He asked. She did not answer. They dried their hands in silence. Inside, Cole took the primary position. Riley stood opposite, ready with suction retractor, whatever the next step demanded. Knife, Cole said. The incision opened, layers parting. Blood welled up dark and thick, more than a simple splenic bruise would give. Suction. Riley moved the tip in with practiced ease, following the plane, clearing the view without blinding the field with turbulence. Her body stayed loose, ready to shift. Cole traced along the left upper quadrant, fingers exploring gently, then with more pressure. There, he said. Capsular tear on the spleen, more than one. No wonder his pressure is in the basement. He set clamps, worked quickly, patching the splenic surface, tying off active bleeders. Riley anticipated each request. Laparotomy pads appeared when his fingers twitched in a certain way. The next clamp was ready before he asked. When he reached for suction, it was already in his hand. At one point, he paused just long enough to glance at her. You have assisted on a lot of these, he said. I have seen a lot, she said. Boston does not get this kind of volume, he said. Boston has its moments, she replied. Patricia watched them from the nurse's side eyes, moving between Cole's hands and Riley's. The bleeding slowed, then stopped. The cavity cleared under the wash of warm saline. Pressure, Cole asked. Climbing the anesthesiologist said, 95/60, heart rate coming down. Cole nodded. Looks like you called it, he said to Riley. If we had waited for CT, we would be chasing a ghost while he bled on the table in radiology. We did not wait, she said. They closed in layers. Riley's sutures on the fascial plane were small, tight, almost invisible. Cole noticed but said nothing. After they were done and Mike was on his way to recovery with a new line of staples on his abdomen and a leg that would need an orthopedist, Riley stepped back out to the scrub sink. She turned on the water. It ran clear over the fingers that still remembered the heat of the OR lights. The sound filled the small space, a steady hiss that almost drowned out the distant beeping of monitors down the hall. She scrubbed once out of habit, though the case was over. Soap slid in white lines over the faint scars on her forearms. The desert had a way of following you even into a windowless room under fluorescent light. It lived in the smell of cauterized tissue, in the sound of blood hitting suction canisters, in the way a body felt under your hands, when life was slipping away. Some things did not stay where you left them. She shut off the water and stared at her reflection in the small metal panel above the sink. The face looking back at her was calm. The eyes were not. The night did not stop for one saved spleen. By the time Riley changed back into clean scrubs and walked out of the OR hallway, the clock over the elevator read a little past midnight. The corridors hummed with the low, constant noise of a hospital that never slept. In the resident lounge, someone had left the television on mute. A sports anchor gestured at a silent highlight reel. Riley switched it off on her way past and headed back toward the emergency department. The closer she got, the louder it became. Voices layered over each other, clipped and tired. A phone rang. A cart rattled. Somewhere a baby wailed in sharp, outraged bursts. She stepped through the double doors into the ER and felt the old familiar shift inside her chest like something sliding into place. Trauma bays were mostly full. Carla stood at the central desk headset, crooked eyes on 3 monitors at once. "Quinn," she called, spotting Riley. "Your spleen guy is in recovery, right?" "He is," Riley said. "Stable for now." "Good. Try to stay put for 5 minutes." Carla did not get to finish the thought. A piercing alarm cut through the room, sharper than everything else. Code Blue Trauma 3. The sound reached into bone. The intercom crackled. "Code Blue Trauma 3. Repeat Code Blue Trauma 3. Riley was already moving. She pushed through the curtain of Trauma 3 and stepped into controlled chaos. 4 people crowded around the bed. A respiratory therapist squeezed a bag over an endotracheal tube. A resident pumped compressions into a still chest. The monitor showed a flat green line decorated only by artifact from the chest movement. The heart was not contributing. Dr. Maya Singh stood at the head of the bed, eyes on the clock. 16 minutes of CPR, she said. 3 rounds of epinephrine, 2 shocks, no organized rhythm. Still nothing, said the resident doing compressions. Sweat ran down his temple and dripped from his nose onto the sheet. "Switch," Singh said. "Jordan, take over." Jordan stepped up, hands landing in the center of the man's sternum. He started compressions without missing a beat, shoulders stacked over his wrists. "Who is he?" Riley asked, coming to the bedside. The man on the gurney looked younger up close, maybe late 20s. Brown hair matted with blood near his temple. His construction vest had been cut away, a dressing wrapped around his lower abdomen already soaked dark. "Ethan Morales," Jordan said between compressions. 28 foreman at a highway job, hit by a truck that lost control at the site. They pulled a piece of rebar before EMS got there. He grunted as his hands drove down. BP was dropping on the way in. He lost pulses right as we hit the bay. The smell of blood sat thick in the room, copper and salt and something heavier. The bandage over Ethan's abdomen oozed from the edges, a slow, steady seep. Singh glanced at the monitor again. Flat line. The long tone droned over everything. "Time," she said. 19 minutes, the nurse by the crash cart answered. "Continue compressions," Singh said. "Another dose of epi." Her gaze met Riley's. "We have done everything," Singh said. "There is no cardiac activity. The bleed is massive. The damage is likely non-salvageable." Riley stepped closer. She let her eyes run over Ethan from head to toe. Pale lips, skin cool and clammy under the film of blood and sweat. Abdomen distended above the dressing, more on the left than the right. The way the soaked gauze sagged hinted at where blood was pooling underneath. Something old and familiar flicked on in her mind, the part that had woken in tents and helicopters and warehouses with no windows. "No," Riley said. Singh's brows drew together. "What do you mean, no?" "He is not done," Riley said. Singh's voice stayed even. "There is no rhythm," she said. "We have no response after prolonged resuscitation. Even if we got his heart back, he would likely sustain significant brain damage." Riley heard the words. The monitor hummed. Under her hand, the blanket over Ethan's abdomen was warm and firm in the wrong places. "He has a retroperitoneal hemorrhage," she said. "Probably from a torn iliac artery. The blood we are pushing in is just leaking into the space behind the peritoneum instead of returning to his heart." Singh shook her head. "Even if that is true," she said, "there is no time to open him and find it. He will bleed out before we get control." "There is another way to buy time," Riley said. "Which is what?" Singh asked. Riley looked at the monitor, then at the clock. "Re-BOA," she said. "Resuscitative endovascular balloon occlusion of the aorta." The room seemed to tighten. "That is experimental," Singh said. "We do not use that here." "We should," Riley said. "We place a balloon catheter through the femoral artery, advance it into the aorta, inflate it above the injury. It stops flow to the lower body long enough to perfuse the heart and brain. He regains a pulse. Then we take him to the OR to repair the tear. That procedure carries a high complication rate," Singh replied. "Aortic injury, ischemia, limb loss." "The complication rate is lower than the mortality rate of doing nothing," Riley said. Jordan did not stop compressions, but his eyes flicked up at Riley. "I have seen it. he said quietly. REBOA. Once. Afghanistan. We were losing a guy with a pelvic blast. They did that. He walked onto the plane 2 weeks later. Singh's mouth tightened. This is not a war, she said. Riley's voice stayed calm. His anatomy does not know that, she said. The curtain at the bay entrance snapped open. Dr. Aaron Cole stepped inside, tie askew hair slightly mussed, as if he had dragged a hand through it one too many times. I leave you alone for 30 minutes, Karawi said, and I hear someone is asking for an endovascular aortic occlusion in my trauma bay. What is going on? Singh pointed at the monitor. Ethan Morales, she said. Blunt abdominal trauma, probable vascular injury. We have been coding him for 19 minutes with no rhythm. I am about to call it. And Dr. Quinn is suggesting we perform a battlefield procedure we are not credentialed for, Cole said. Correction, Riley said. I am credentialed for it. Cole turned his head slowly. Were you planning on mentioning that before or after we lose our license? He asked. Before she could answer, another figure appeared in the doorway. A paramedic in a dark blue uniform stood there, chest rising fast, as if he had jogged the last stretch. Gray threaded his close-cut hair. His nameplate read Lawson. His eyes landed on Riley, and for a moment his whole body went still. You are kidding me, he said under his breath. Then louder, Major Quinn. The room shifted around that name. Jordan's hands faltered for half a second. Singh stared. Cole's gaze snapped between Lawson and Riley. Major, Cole repeated. Lawson stepped closer, ignoring the alarm's constant whine. Riley Quinn, he said. 325th Combat Support Hospital. We were in Mosul. You put a balloon in a guy's aorta in the back of a Black Hawk while we were taking fire from 3 directions. He was dead when you started. He left the country breathing. Silence pressed in for a beat. The only sound was the bag valve mask and Jordan's compressions. Cole looked at Riley. You were Army, Twihidu said. You left that off your application. I left a lot off my application, Riley said. The monitor held its flat green line. You know how to perform REBOA, Cole said. Yes, Riley said. How many times? 12, Riley said. 10 survived. The died. And the other 2, he asked. They were gone before I started, she said. Like he will be if we stand here arguing. Cole watched her face. Her shoulders were square. Her hands were already reaching mentally for equipment. If you are wrong, he said, and this goes badly, I will have your license. If I am wrong, Riley said, he is already gone. Jordan's arm shook with effort, but he did not slow. Choose, he said to Cole. We are burning time. The head of trauma took in the monitor, the young man on the bed, the ring of people waiting for a call. Get her a REBOA kit, bolt, Cole said. Ultrasound femoral access, a balloon catheter if we have it or the closest thing. I am supervising every step. The room snapped back into motion. The crash cart shifted. A nurse sprinted for supply. Someone pulled the sheet higher to expose Ethan's groin. Jordan continued compressions, counting under his breath. Riley pulled on a fresh pair of sterile gloves. The world narrowed to the space over Ethan's femoral artery. Jordan moved to the head on my count, she said. We will coordinate with the ventilations. Gel spread cool over Ethan's inner thigh. The ultrasound probe slid, bringing up grainy images of vessels and tissue. Riley found the femoral artery a round pulsing circle against the darker background. Angle at 60 degrees, she said softly, more to herself than anyone else. The needle in her hand glinted under the light. She watched its white tip appear on the ultrasound screen, a bright line descending toward the vessel. The artery dimpled, then gave way. Blood flashed back into the hub, dark and thick. I am in. She said. She threaded the guide wire through, watching it move on the screen as a fine line curling up into the pelvis. The nurse handed her the dilator, then the balloon catheter, her hands steady despite the urgency. Passing the catheter, Riley said, keep compressions going. Jordan's hands worked around her movements. Bag squeezes matched the push of his palms. Portable fluoroscopy flickered to life at the foot of the bed. The radiopaque tip of the catheter stood out a tiny bright point traveling up the shadow of the spine. Zone 1, Riley said, above the celiac. We want it high. The tip settled just below the level of the diaphragm. She removed the wire and attached a syringe to the balloon port. Inflating, Shah, she said. 1 milliliter at a time. She pushed saline in. On the pressure transducer numbers shifted. Stop compressions, she said. Jordan lifted his hands, chest heaving. The room went quiet. The monitor flattened for a second under artifact, then cleared. For a heartbeat, there was nothing. Then a tiny spike appeared, then another. Pulseless electrical activity, Singh said, almost reflex. The spikes grew taller, closer together, coalescing into a slow, irregular rhythm. The arterial line traced a small wave, then a larger one. Check for pulse, Cole said. Jordan's fingers went to Ethan's neck. He closed his eyes for half a second, feeling. "I have something," he said, faint but there. The tone from the monitor changed. No longer a solid drone, it became a series of spaced beeps, uneven but present. Riley kept one hand on the catheter, feeling its line against Ethan's skin. "The balloon is holding," she said. "We have stopped the bleeding below. All the volume he has left is going to his heart and brain." "For how long?" Cole asked him. "Maybe 30 minutes before the lower body starts taking real damage," Riley said. "We need an OR with vascular ready. We fix the tear and come off the balloon under control." Cole was already reaching for his pager. "This is Cole," he said into it. "I need OR1 now. Vascular on call in the room. Tell them we have aortic occlusion in place and a retroperitoneal bleed to repair. They have 20 minutes to be scrubbed." He hung up and looked at Riley. "You are coming with us," he said. "You started this. You stay with it." The beeps on the monitor kept time with his words, uneven yet but real. Ethan Morales, who had been a flatline in a crowded trauma bay, now had a heart rhythm again. Jordan wiped sweat from his forehead with his forearm. "Welcome back, Morales," he said quietly. Riley kept her hand on the line of the catheter while the team prepared to move the bed. The rubber of the glove squeaked slightly against the plastic. She glanced once at the ink hidden under her sleeve, felt the faint pressure of it against her skin. "Hold fast." The words were not loud, but they were clear. The elevator ride to the OR floor was quiet except for the soft beep of the monitor and the low hiss of the oxygen. Riley stood at the side of the gurney, one hand steady on the line of the catheter at Ethan's groin. The balloon sitting inside his aorta felt abstract, unreal until she glanced at the monitor and saw the irregular rhythm it was buying. His skin had a hint more color now. Not much, but more than the waxen pallor from minutes before. In the scrub room outside OR, the air smelled of antiseptic and metal. Riley released the catheter to the vascular tech with careful instructions, then turned to the sink. The water roared to life hot from the first second, beating against her hands. She scrubbed in long strokes up to her elbows, the motions automatic from years of repetition. Cole took the sink beside her. For a while, neither of them spoke. The only sounds were water soap, the distant muffled voice of someone in the OR calling out a supply list. "You did not hesitate," Cole said at last, eyes on his fingers. "There was not time," Riley said. "There is never time in here," Cole replied. "Some people still freeze." "I know what it looks like when you are already too late," Riley said. He glanced at her. "That was not textbook work," he said. "That was drilled in somewhere that does not have many textbooks." Riley rinsed the soap away. Pink water ran down into the basin. "I told you," she said. "I left a lot off the application." "Not anymore," Cole said. They dried their hands and stepped into OR1. The lights were bright enough to make everything look sharper. Ethan lay in the center of it, draped and prepped the line of the catheter coming up from his groin and taped in place. The anesthesiologist, Dr. Patel, stood at his head eyes on the monitor. "Blood pressure is holding at 90/50 with the balloon up," she reported. "Heart rate 98, good end tidal." "How long since inflation?" Cole asked. "About 12 minutes, Patel said. "Then we move," Riley thought. She stepped to the table across from Cole. Her lungs expanded in a measured breath that did nothing to slow the pounding in her chest. "Scalpel," Cole said. The nurse placed it in his hand. He cut from the pubic bone up toward the umbilicus, the line deliberate and fast. Layers parted. Skin fat fascia. "Retractor," he said to the... Yeah? Ed? Riley held it while he opened the peritoneum. There was a moment of resistance, then the cavity gave way. Without the balloon, blood would have burst out under pressure. Instead, dark coagulated clots sat thick behind the tissues, like mud caught in a floodplain after the water had been dammed. "A lot of stored trouble," Cole murmured. "Suction," Riley said. The tech handed over a large bore suction. Riley guided it, pulling out clots, clearing a field through which they could see. Each clot that left revealed more of the distorted retroperitoneal space. "There," Riley said, referencing the left side. "Follow that." Cole dissected along the source of the hemorrhage. The external iliac artery came into view swollen and purple where it should have been pale and smooth. Along the lateral wall, a 2-centimeter tear gaped open, the edges raw. "Clean laceration," Cole said. Cole said. "He must have sheared it when the rebar came out." "At least we can repair that," Riley said. "Not with the balloon up," Cole replied. "No flow, no way to test the line. You know the drill." Riley nodded. "We will get proximal and distal clamps ready," she said. She positioned 2 vascular clamps within reach. The metal clicked softly as she tested them. Her fingertips tingled. She reached down to the catheter line, found the balloon port. Dr. Patel, she said, we are going to deflate. Be ready. He will drop. 2 units hung and ready, Patel said. On your word. Riley withdrew the saline from the balloon, slowly counting in her head. The pressure trace on the monitor shifted. Down below the repair site, blood surged again. For a few seconds, it had nowhere to go besides the open tear. The laceration sprayed red into the field. Proximal clamp, Riley said. She closed the clamp above the tear, firm and precise. Blood flow stopped on that side. Her other hand moved to place the distal clamp. The bleeding dropped to a trickle and then ceased. Transfusing, Patel said, pressure dipping to 70, 65. We have it, Riley said. The artery lay between the clamps, still and empty. 6-O-proline, she said. The needle holder dropped into her hand. The suture thread was so fine it shimmered like hair under the lights. Cole watched her. You take it, he said. Riley placed the first stitch at one end of the tear, her hand steady. She spoke less and less as she worked. The world shrank to the tip of the needle, the feel of arterial wall under it, the rhythm of in and out pull and tie. 12 stitches each, about 2 millimeters apart, each bite taking just enough tissue to hold firm. The OR sounds faded. The soft whir of the ventilator, the beeps of the monitor, the muffled movement of the staff at the periphery, all of it blurred into a background hum. The last knot slid into place. She cut the tail. Distal clamp off, she said. Cole nodded to the tech. They opened it first. Blood flowed into the artery below the repair, filling it slowly. The line held. Proximal, she said. The second clamp came free. For a heartbeat, nothing happened. Then crimson flooded through the repaired segment under full arterial pressure. No leak, no seep, no blossom of red from the stitch line. Nice work, Cole. Yeah, Cole said. On the monitor, the numbers climbed. Pressure coming up, Patel called. 92/60, heart rate settling at 85. The tightness in Riley's chest loosened a fraction. Check for additional sources, she said. They scanned the rest of the abdomen. No new bleeds revealed themselves. The clots had all come from the iliac tear. Once it was closed, the rest of Ethan's body was just bruised and battered, not destroyed. They irrigated with warm saline. Fluid pooled clear at the bottom of the cavity. Close, Cole said. They closed the fascia, then the subcutaneous tissue. Staples drew the skin together in a clean metallic line. The dressing went on. When they finally stepped back, Ethan looked smaller under the drapes, swallowed by the table and monitors. The lines and tubes made him look fragile and invincible at the same time. He's going to need time, Patel said, but he has a real shot. We will take it, Cole said. They transferred Ethan to a transport bed and rolled him out toward the surgical ICU. The monitor above his head beeped in a steady rhythm. Now, no long tones, no blank spaces. Riley peeled off her gloves once he was gone from view. Her hands were damp, the air cool against her skin. In the ICU corridor, the lights were dimmer. Machines hummed behind glass doors. Nurses moved in slower, deliberate patterns, watching drip rates and ventilator settings. Riley stood at the window of Ethan's new room. Inside, a nurse checked lines, adjusted the ventilator. Ethan's face looked softer now without the harsh overhead light framed by the plastic curve of the breathing tube. Cole came to stand beside her. He rested his hands on his hips as if they were heavier than usual. He was done in that baby, he said, by every conventional measure. He was close, Riley said. Cole glanced sideways at her. You did something that most surgeons in this building have never done, he said. You did it in a room not built for it with a team that had never seen it, and you still got him here. It was not just me, Riley said. No, he agreed. It was not. But you were the one who refused to stop. They watched the monitor for a moment. The green spikes marched across the screen like a new kind of metronome. How many times did you ride that line, Cole asked, between too late and just barely in time? Riley thought of sand under her boots, hot metal under her knees, rotors beating the air so hard it vibrated in her teeth. She thought of patients who had lived and those who had not. Enough to know you never forget their faces, she said. Footsteps approached. Dr. Evelyn Hart stopped on Riley's other side. The chief of medicine carried a tablet tucked against her chest. Her hair was pulled back tight, a few strands standing out after hours on duty. I wondered when we would have this conversation, Hart said. Cole straightened a little. You saw the rebo note you will be there? You most know, he said. I saw everything, Hart replied. I asked for a deeper pull on Dr. Quinn's file, the unedited version. Riley kept her eyes on Ethan. Hart went on. 7 years active duty, she said. Combat surgeon, 3 tours, 1 in Kandahar, 2 in northern Iraq, almost 900 documented surgical cases, survival rates that would make most trauma centers jealous. She scrolled on the tablet. And then the helicopter, Hart said more quietly. The corridor seemed to narrow. We were taking patients from a forward site to a larger base, Riley said. 3 wounded soldiers, 2 civilian contractors, routine medevac. She tasted dust again. The air conditioner did not quite wash it away. They hit us with an RPG, she said. Tail rotor first, we started to spin. Hart listened without interrupting. It went down hard, Riley said. I woke up on the floor with a stretcher pinning my legs. There was fire toward the back. One of the soldiers was still breathing. I got him free, dragged him to the door, went back for the others. Her voice stayed level, but her throat felt tight. I got one more out, she said. By then the fire had spread, the fuel went. 3 of them died before I could reach them again. She could still hear the way the skin of the aircraft popped and shrieked in the heat. They told me afterward I did everything right, Riley said. That my actions saved 2 lives. That no one could have done more. You did, Cole had said. They also told me something else, Riley said. There was an investigation. They found evidence that our flight path had been compromised. Hart's eyes darkened. Leaked, she said. Sold, Riley corrected. Someone gave our route to people who wanted the bird on the ground. We were convenient targets. Silence settled heavier than before. I could not keep sending people onto helicopters after that, Riley said. Not when I knew someone might have already written their names on a list. I took the medical discharge, PTSD, came home, tried to start over. In Portland, Hart said. In Portland, Riley echoed. And before that, in a small clinic in the middle of nowhere. Places where no one knew Major Quinn, where I could be just another tired doctor who drinks bad coffee and misses sleep. Hart nodded slowly. And then you walked into my trauma bay, she said, and brought a dead man back to life with a battlefield tool. I did what I was trained to do, Riley said. You did more than that, Hart said. You showed us a gap we did not even know we had. She turned the tablet so Riley could see the screen. It showed a summary of Riley's service record, stripped of the black bars that had hidden half of it in the hospital's version. I'm not here to punish you for leaving things off your application, Hart said. Given what you went through, I understand why you wanted to disappear into the system. Her tone sharpened. But now I know who you are, she said, and I am not going to pretend I do not. Riley finally looked at her. What are you saying? She asked. I am saying, Hart replied, that this hospital needs you as what you actually are not as a ghost in a second-year coat. She held Riley's gaze. And I am saying you cannot carry all of this alone without help. Not if you intend to keep doing what you did tonight. Riley waited. Hart did not look away. You are still on the books as a second-year resident, Hart said. Technically, practically you have more trauma experience than anyone here under the age of 50. On paper, Riley said, I transferred programs twice in 3 years and left gaps in my history. That usually looks like instability. On paper, Hart replied, you are complicated. In reality, you just pulled off a thing most of my staff would not even attempt. She shifted the tablet back against her chest. So here's what I want, Hart said. You stay here not as a hiding place, but as an attending in trauma surgery. Full privileges. You help us build a program that prepares this hospital for nights like this. You train our people to see what you see. Riley stared past her for a moment at Ethan's monitor. The green spikes kept time with the ventilator. Each beat looked improbable and ordinary at once. You cannot just snap your fingers and make me an attending, Riley said. I can, Hart said. There will be paperwork and yelling and a board meeting, but it is all noise. You have already proved your competency more than any exam could. There are rules, Riley said. Rules bend, Hart said. Standards do not. You meet the standards. Cole watched them both, arms folded, expression thoughtful. There are conditions, Hart added, non-negotiable. Of course there were, Riley thought. 1, Hart said, no more hiding. Your service record goes into your file as it actually is, not as a redacted story. People need to know who they are standing next to in the bay. Riley's jaw tightened. 2, Hart said. You design and run a trauma training program, not just lectures, hands-on, simulations, protocols that come from what you learned in all those places that do not make it into journals. And 3, Cole said quietly, as if he had already guessed, you get help. Hart nodded. You see someone who understands combat trauma, she said. Regularly. You are still carrying that helicopter on your back, Dr. Quinn. You cannot keep doing nights like this and pretend it is not there. Riley was quiet. The ICU hummed around them. A patient coughed in another room. A nurse laughed softly at a joke near the station. I already did the evaluations, Riley said. The board, the psych tests. And then you left, Hart said. You built a new life on top of the old one without really cleaning anything out. Riley thought of the little Army Medical Corps pin at the bottom of her bag buried under granola wrappers and loose pens. "You want me to be a symbol," she said, "the war doctor who found a home in a civilian hospital." "I want you to be useful," Hart said, "to yourself and to this place." Cole spoke before Riley could answer. "You kept a man from becoming a body tonight," he said, "because you were willing to do something that looked insane in this environment. We can either punish you for that or give you the authority to do it right." "That is an oversimplification," Hart said. "It is accurate," Cole replied. Riley looked at Ethan one more time. His chest rose and fell with the machine. His hands tied loosely so he would not pull at the tubes when he woke were broad and calloused. She pictured them holding a wrench, a lunchbox, a small hand on a playground. "His family," she said. "Do they know?" "They arrived while you were in the OR," Hart said. "His wife is in the waiting room. She has been asking for you since Carla told her what you did." Riley's shoulders pulled back the way they always did right before walking into something that did not involve a scalpel, but still felt like a cut. "I will talk to her," she said. Hart nodded. "When you are ready, come find me," Hart said. "We can argue about titles and salaries later. Try not to vanish before then." She walked away down the corridor. Cole stayed. "What are you going to do?" he asked. Riley let out a breath. "Talk to his wife," she said, "one thing at a time." The family waiting room sat just off the ICU hall. Its walls were painted a color that was probably meant to be soothing. A muted television played a nature documentary without sound. A coffee pot hissed quietly on a side table. A woman stood when Riley entered. Late 20s hair pulled into a messy knot. Ethan's fluorescent vest folded over one arm like a flag. Dark circles shadowed her eyes. A little girl slept on the couch, knees tucked under herself, a stuffed dog clutched in one fist. "You are Dr. Quinn," the woman said. "Carla said I should wait for you." "Yes," Riley said. "You are Mrs. Morales." "Lena," she said, "please." Her voice shook on the word. She gripped the back of the chair in front of her, as if to keep her hands from shaking too. "Is he—" she started, then stopped, swallowing hard. "They said he died, and then he did not." Riley pulled a chair closer. "May I sit?" she asked. Lena nodded. Riley sat, keeping her tone as steady as she could. "Your husband lost a lot of blood," she said. "His heart stopped in the trauma bay. We were doing CPR for nearly 20 minutes. Lena's knuckles went whiter. "We were able to use a procedure that temporarily stopped the bleeding inside his abdomen," Riley said. "That let his heart start beating again. Then we took him to surgery and found the torn artery. We repaired it. Right now his heart is working on its own. He is in the ICU. "Will he wake up?" Lena asked. "There is a very good chance he will see," Riley said. "He is still critical. The next day or so will tell us more. But what is happening now is what we want to see." Lena covered her mouth with her hand. Tears slipped from the corners of her eyes and slid along her fingers. "They told me to prepare," she said. "When they brought me in, they said he might not make it. That even if they did everything, it might not be enough. And then Carla came back and said you did something she had never seen. It was a tool I learned in another job," Riley said. Lena looked up sharply. "Whatever job that was," she said, "I am glad you had it." She dragged in a breath, tried to wipe her face, gave up and let the tears fall. "We have 2 kids, she said. Diego and Marisol. He drives them to school every morning. He promised my son he would teach him to drive on the same road he takes to the job site. I kept thinking, how do I tell them their dad is not coming home from work?" Her voice broke on the last word. Riley's chest ached in a way that had nothing to do with adrenaline. "You are not telling them that tonight," Riley said. Lena nodded, eyes squeezed tight. "Can I see him?" she asked. "Yes," Riley said. "The nurses will help you in. There will be a lot of machines. He will look different, but he is still your husband." "Thank you," Lena said. She reached for Riley the way a person grabs for a rail on stairs. The hug came quick and tight. Riley stiffened for a heartbeat, then let herself return it, feeling the slight tremor in Lena's shoulders. "Thank you," Lena said again into her shoulder, "for not giving up." Riley did not trust her voice, so she only nodded. Later in the quiet of the on-call room, sleep did not come. The cot was too narrow, the blanket too thin, the memories too loud. When she closed her eyes, she saw the inside of Ethan's abdomen, the torn artery, the rush of blood when the clamp came off. A different part of her mind replayed fire on metal desert night through a cracked window, a rotor spinning uselessly. Her pager sat on the pillow beside her head, dark for the moment. The little metal pin from the army sat on the shelf above her where she had left it after digging it out of her bag. It caught the light from the hallway through the crack under the door. She rolled onto her back and stared at the ceiling. Hold fast, the ink at her wrist said. It had been a promise to others once. Maybe tonight it had been a promise to herself. Morning came as a faint grayness through the small high window. The shift change announcements crackled over the speakers. Riley pushed herself up joints, protesting, and went to check on her patients. Ethan was still intubated, but his numbers looked better. Lena sat by his bed hair, now in a loose braid, fingers resting lightly on his forearm above the tape. She looked up as Riley stepped in. "They say he squeezed my hand," Lena whispered. "Not much, just once." "That is good," Riley said. She checked the chart, then the incision, then the lines, more out of habit than doubt. "You will see more of that," she said. In the afternoon, Hart called a meeting in a small conference room just off the admin wing. Cole was there along with the director of surgery and a few faces Riley knew from committees she usually avoided. They talked for an hour. About credentialing, about military experience, about how to translate one world into another without losing the parts that mattered. When it was done, Hart slid a folder across the table toward Riley. "Temporary attending privileges in trauma," Hart said. "Effective immediately pending formal board approval. You will still finish the academic requirements you are missing, but you will do it from this seat, not from the back row." Riley opened the folder. The letters on the page looked too sharp. "This fast," she said. "It is not fast," Hart said. "You have been training for this for 7 years. We are just catching up." Cole gave a short nod. "Welcome to the team properly," he said. The next week, Riley stood at the front of a lecture room she had sat in as a resident not long before. The rows were full. Residents in rumpled scrubs, nurses still in their trauma shoes, a few paramedics with their jackets tied around their waists. On the screen behind her, an image of a heart monitor filled the space. It showed a flat line on one side, then the uneven rhythm from Ethan's bay after the balloon went up. "I am Dr. Riley Quinn," she said. "Some of you know me as the transfer. Some of you know me as the one who yelled about a perforated appendix last week." A few people smiled. "Before this," she said, "I worked in places where the rule was simple. If you stop trying, people die. If you keep going, some of them live." She let that hang there, not as a slogan, but as a fact. "We are going to talk about tools today, Wasio," she said. "Not magic tricks. Tools. Ways to buy time, to think, to act. Some of them are messy. Some of them are not in your textbooks yet. You will see why they should be." There were pens-ready tablets, awake eyes on her. Riley glanced at the first slide in her notes and then left them on the podium. The story flowed easier without reading. She walked them through Ethan's case, through the decision points, through the anatomy. Jordan chimed in from the back with his view of the code. Patricia added a comment about what it felt like to watch a body come back under her hands. Later in the simulation lab, they stood around a mannequin wired to a monitor. The screen displayed a flat green line. The long, uninterrupted tone filled the room, familiar and awful. A nervous intern looked at Riley. "When do we stop?" he asked. Riley looked at the monitor, then at the fake chest rising under the compressions. "When you know you have truly run out of things to do," she said. "Not just when it feels like you should." She picked up an ultrasound probe and placed it in his hand. "Start by looking," she said, "then decide if you are really done." The tone continued for a moment longer, then cut out as the scenario reset. That night, after the sessions ended and the lab lights dimmed, Riley walked back through the ER. The bays were quieter than usual. A drunk slept in a corner stretcher. A nurse wiped down a bed, humming under her breath. In Trauma 3. The room where Ethan had lain the bed was empty. Fresh sheets, no blood on the floor, no memory in the walls if you did not know how to see it. She stepped in and stood where she had stood that night, between the bed and the monitor. The screen was dark. She rested her thumb against her wrist, feeling the faint rise of the ink through the fabric. The hospital was full of people who had walked away from flatlines. That was normal. That was survival. She understood it. She also knew, standing there in the quiet, that she was someone who stayed. The beeping from a nearby bay started up steady and small, pulling her back into motion. Riley turned toward the sound and went to work. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.